all think we know about weight, don't we? You know, calories, exercise, simple.
Yeah, but what if it's way more complicated?
Exactly. What if there's this whole other angle we're missing? Something
Oh.
that changes how we should even, like, approach health.
That's really the core question for today's deep dive.
Mm.
We've been looking at what Queen Latifah has been saying recently, with the Truth About Weight campaign.
Right, the USA Today stuff.
Yeah, exactly. And this isn't just some celebrity talking point. She's really pushing for a big shift in how we understand obesity.
It's definitely not about Hollywood image, is it? She seems focused on something much, much deeper.
Totally.
So our mission today, digging into these sources, is to really unpack her message. Why is it so important to see this as more than just, willpower? What's the shift she wants?
Okay, so the absolute foundation of her argument, and it's really clear, is this quote: "Obesity is a disease and should be treated as such."
Not treated as some sort of character flaw.
Precisely.
Yeah.
Or people not trying hard enough. That right there, that's the game changer. It reframes the whole thing.
Away from blame.
Away from blame, yes, and towards seeing it as a legitimate health condition, with biology involved.
Okay, let's unpack that because, a lot of people listening might still think, but wait, isn't it diet? Isn't it exercise? Why does framing it as a disease actually help someone who's struggling?
Well, think about it. If it's a disease, it kind of, it validates what they're going through, right?
Shakes the shame away.
Exactly. It lifts that huge burden of self-blame, which can be so isolating. It can actually stop people from even going to the doctor.
Huh. I hadn't thought of that barrier.
Yeah. And seeing it as a disease, it opens up the conversation to, more solutions, medical help, research, not just eat less, move more.
Which can feel really simplistic sometimes.
It often is.
And Queen Latifah is putting her voice behind this Truth About Weight campaign. What's the main goal there? What are they trying to shift in society?
So the campaign's core aim, based on what we're seeing, is tackling that stigma head on. The bias.
She talks about that a lot.
She does. She mentions changing the stigma, changing the bias, and opening a door to people who are dealing with obesity. It's about changing attitudes.
And that stigma, you see it everywhere, don't you? Sometimes subtle, sometimes not so subtle.
Oh, absolutely.
But what does it actually do to people? What are the real impacts of facing that bias?
Well, there's actual research on this. A study in the BMJ Open Diabetes Research and Care Journal.
Okay.
It found a direct connection between experiencing weight bias and increased stress.
Stress. How does that connect?
Well, the interesting thing is the stress itself can trigger physiological changes, hormones and stuff.
Wow.
Which kind of ironically can make weight gain worse.
No way. So the bias itself contributes.
Yeah. And the study also linked it to more depression, more anxiety, poor body image. It's a real negative cycle.
So it's not just about hurt feelings. It's hitting physical and mental health hard.
Definitely. Both.
That really makes you pause and think about how we talk, how we judge. Okay, so the articles also get pretty serious about the link between obesity and, major health problems.
Absolutely. That's a huge focus, especially the connection to cardiovascular diseases.
Heart stuff.
Yeah, heart attacks, strokes, all that. The risk goes way up. And the CDC numbers are pretty stark.
What?
2 out of 5 adults in the U.S. have obesity. 2 in 5.
That's a lot.
It is. And the rate's even higher among Black women.
And what's the bigger picture impact of heart disease?
Well, according to the CDC info in these sources, heart disease is the #1 killer in the U.S. Over 700,000 deaths a year.
More than cancer.
More than cancer, more than accidents, more than respiratory diseases.
Yeah.
It just puts the scale of this into perspective.
And for Queen Latifah, this isn't just statistics, it's personal.
Very personal.
Yeah.
And that brings a real weight to her message. She talks about her mom's struggle with a heart condition, losing her eventually.
That must have been incredibly difficult.
Yeah. And she also lost a cousin because of obesity's effects. She said something like, "Having lost a cousin, who was one of my funniest cousins, my coolest cousin, who had 8 kids to raise, was sad to see. That was really rough."
Wow. Hearing that, it really makes it human, doesn't it?
Yeah.
Beyond the numbers.
Absolutely. You feel the impact on families.
So, okay. If obesity is a disease, serious risks. What's her advice for people dealing with it? How does she want them to approach it?
Her big message there is empowerment. Get informed. Talk to your doctor.
Knowledge is power, basically.
Exactly. She really emphasizes that the more you know as a patient, the better you can communicate honestly and openly with your healthcare provider.
And she's pretty direct about how to talk to doctors, too, isn't she?
She is. I love this quote. She says, send them to work a little bit. They go to school for this. This is what they train to do. They are a doctor.
Mm. I like that. Don't be afraid to ask questions.
Right. Make them explain things. Be an active partner in your own health. You have that right.
That's so important. Advocating for yourself. But it can't all be on the patient, surely. What about the medical side? What's their responsibility?
Oh, definitely not just on the patient. The sources make it really clear the medical community needs to face its own weight bias.
How so?
Well, that BMJ study we mentioned, it actually pointed to new guidelines from the Obesity Association and part of the American Diabetes Association, specifically about tackling this bias in healthcare settings.
And that means more than just changing attitudes, right? It's about practical stuff, too.
Yes, practical, tangible things. The study gives examples like making sure waiting rooms have chairs that fit everyone comfortably,
Okay, yeah.
having exam tables that work for different body sizes, making sure the equipment like blood pressure cuffs fits properly.
Seems basic, but probably makes a huge difference to how someone feels walking into a doctor's office.
A massive difference. It impacts whether people feel respected, whether they even want to seek care.
It's about creating that safe, respectful space. There was a quote from Dr. El Sayed.
Yes, Dr. Nuha El Sayed. A really powerful statement. Every person, no matter of their size, deserves kindness, dignity, and high-quality healthcare.
That sums it up perfectly. Kindness and dignity.
Should be the standard.
Now, something else interesting. It seems like the very definition of obesity, the BMI thing, is being looked at again.
That's right. The old standard, BMI of 30 or more, it's being questioned. People are realizing it's maybe too simple.
How so?
Well, the Lancet Commission, mentioned in the articles, suggested we need other ways to measure things, to get more nuance,
Right.
to understand individual health risks better.
So just that one number, BMI, might not tell the whole story about someone's actual health.
Exactly. There's this growing understanding that risk isn't just about weight, but where the weight is. Body composition like muscle versus fat, your overall metabolic health.
More important complex.
Way more complex than just height and weight on a chart.
For sure.
And, throughout all this advocacy, Queen Latifah has also shared bits of her own story, her own journey with body image. Yeah, she's been quite open, talking about growing up in Newark and East Orange, New Jersey,
Right.
and comparing herself to her parents.
Mm-hmm.
She joked about thinking, like, when your mother looks like Diane Carroll and your father looks like Billy D. Williams, you're wondering, what's wrong with me?
Oh, wow. That feeling of comparison, especially when you're young, so relatable.
Totally. And she tells this story about being cut from the kickball team
Yeah.
and how her mom didn't just let her feel bad, but really built her up, focused on her other strengths,
Yeah.
sports, singing, acting, built that confidence early on.
That kind of support is huge.
It seems like it really was foundational for her,
Right.
helping her break into male-dominated rap, then starring in Living Single, which was so groundbreaking.
Yeah, absolutely. And she has this amazing quote about confidence.
Oh, the one about owning the room?
Yes. There's nothing more beautiful to me than a confident woman who walks in a room and owns that room based on her confidence, not what her body looks like.
It's such a powerful message, isn't it?
Mm.
It goes way beyond just weight. It's about self-worth.
It really is. Okay, so as we wrap up this deep dive, drawing on Queen Latifah's insights, the research, what are the main things you think listeners should really take away?
Okay, key things. 1, obesity is a disease.
Mm.
We need to shift away from blame and towards understanding and medical approaches.
Got it. Disease, not flaw.
2, stigma is real. It's damaging mentally and physically. We need to challenge it.
Stigma hurts. Okay.
3, the health risks, especially heart disease, are serious, very serious. 4, patients need to be informed and advocate for themselves with their doctors.
Empowered patients.
Right. 5, the medical world needs to get better, address its own bias, make spaces inclusive, exam tables, chairs, attitudes.
Healthcare needs to adapt.
And 6, our whole understanding is evolving. BMI isn't the full picture. It's more nuanced.
Okay, that's a great summary. And running through it all is Queen Latifah's personal story and that message of confidence being key.
Absolutely. Your value isn't your size. It's your confidence, yourself.
So maybe a final thought for everyone listening.
Yeah, maybe consider this. How much are our own ideas about health shaped by these societal biases we've been talking about? Maybe without us even realizing it.
Good question.
And following on from that, what small things can you do in your own life, your own conversations, to push for a more supportive, more informed view of health, for everybody, whatever their size.
Something to definitely reflect on. Maybe check out some reliable health resources. Keep learning.
Exactly. Keep the conversation going, but keep it informed and kind.